Girl, come on inside. Yeah. You can go say hi. Now we're going to do legal review for about an hour until our saunas warm up. It is now about 4:30 in the morning. Now we're sending a bottle of NAD that was ordered from our online store. My wife's not here to do the card that we usually put inside, so I'm just going to send it off. Now it's time to take a sauna. Woo! Already in here. 190 degrees, 200 degrees. Can't even see without my glasses. Okay, let's get this day started.
And onion prices were up 130% from last year.
Is Callie waiting by the door for me to get out of the sauna? There's Bunny waiting at the door for me to get out of the sauna. Should be a pretty easy day. I'll be there from about 8 o'clock, 8:15 till about 5:30 this evening, depending on if the recovery center or the residential program I manage has new patients to see in the afternoon. I know they have one because I checked in with them last night, but sometimes I'll have 2 or 3 and then I'll be there late. And Lisa's out of town, so I had to do cat poop and feed the cats. Oh, so gross. So this is how my day starts as soon as I get to the office. This is absolutely my favorite part of coming to work. Yes, exactly. And that's what we can provide. I always like to, Lindy, under promise and over deliver. Right? So I don't want to tell you, I don't want to paint this magical picture, oversell this, and then you come here and you're suffering and you don't feel like things are working or going well. What I want to say is, look at, you're going to suffer, you have to detox, but we can do a lot to make it way more tolerable, way more manageable. 9 o'clock, I just saw my buddy who'd been a patient for a long time. Quick office visit, just a buprenorphine refill for a couple months. He's doing great, and we talked about his success. He's been off cigarettes for a couple years, so that's great. So that was just a 9:30. That was just a consult about a patient who wants to come in and detox. She's from the Valleys. We talked a little bit about that program, what that would look like. Okay. Awesome. Okay, we'll talk in a few weeks. All right, talk to you later. Bye. So that was a funny conversation. That was a 67-year-old female who came into the practice a few weeks ago, depended on tramadol after some back surgeries, couldn't get off of it. Also has a problem with alcohol. We've gotten together a few times. She stopped drinking. She feels better on the Suboxone than she did on the tramadol. She feels more alive. She feels less brain fog. She has more energy. She feels more clear. We already talked about a taper strategy to come down a couple milligrams every couple of weeks on that Suboxone. At the end of the conversation, she says, "Oh, I remember you now. You were the doctor who took care of my mother-in-law in the ER a few years ago, and you were amazing, and got her set up with hospice and diagnosed her shingles." So that was pretty funny. All right, we're going to see a couple more patients, and I'm going to get IV, and we're going to start my chelation because my lead level came back high.
So if you guys are trying to find the
I hate IVs.
I know you do.
Too fast. The pain over with.
Trying.
I did my cold plunge this morning, so my body is immune to pain.
You did your what plans?
I did my cold plunge this morning. I didn't even feel that. That's better than usual.
That's because that's just how good I am at
You are
it.
good.
A little spot of blood though. I could take a lot of pride in no blood showing up.
Just easy with the tape. The tape is what
I was
kills
gonna
me.
say I barely am gonna tape you.
Just Coban it, like one little piece of tape and then some Coban. Something like that. I mean, definitely don't want it to come loose, but at the same time, I hate the tape.
One pinch. So you don't want.
Good job.
So you don't want to. That's what 6 years of being here does. So if you believe it's been that long?
6 years?
Yeah, pretty much like 6 years.
I don't think I've given you a pay raise.
Tom and I were estimating. I probably put in about 7,500 friggin' IVs.
Or you've had like one pay raise in 6 years?
Actually, hang on a second. Let me help you up before. I've had what?
What, one pay raise in 6 years?
Yeah, I know, huh? Yep, just
Good thing you're rich and don't
like
need the money.
just like the job that much.
You're awesome.
And it's just, it's like one of those things that just, I feel bad for my friends who don't have anything to do.
Doing my infusion, my EDTA infusion, which you can see here in the background, I think, that Catherine made up. Then we just saw our young 26-year-old female who's been doing well on Suboxone now. For a few months, she did have a relapse after 2 or 3 years of being really stable. But she's got a job. She's living with her mom, who's also a patient. And doing good, so it's good to talk to her. It's a great family. Just left a message for a young lady who's been in and out of the program for some time. I haven't seen her in a few years, and apparently she just had meth-induced psychosis and a brain injury from a heroin overdose and was in the hospital. So her family reached back out to do a detox program. We saw her a few years ago. At that point, she was on the street and really couldn't do any programming with us. So hopefully she's in a better spot. Left her a message. Just had another quick follow-up with my friend who has been on a low dose of Bupe. We just talked about his taper schedule over the summer. He was doing good. And how his decision to buy an above-ground pool did not work out for him or his family. And next, now we're doing a Department of Transportation motor vehicle medical exam for a truck driver. And I'll just take a few minutes. So the last patient was not a DOT physical exam. It was a former patient who got high on meth and fentanyl a couple years ago, had a car accident. The DMV pulled his license because of his altered level of consciousness. Last year, I did a form saying he doesn't have an ongoing medical problem, it's just a one-time thing. And they put him on probation and required the same form to be completed this year, so I just had to meet with him, talk to him, fill out a DMV form. His drug screen was negative. He did relapse recently, but it's clean now. So he's a nice kid, working his own program. Okay, it is now 11:35. I am free till noon. I have a video meeting at noon, and then I have 1, 2, 3, 4, 5, 6, 7, 8 inpatient follow-ups, and about 3 or 4 phone follow-ups with a local substance abuse treatment program I work with. And then at 4:40, I'll do the telehealth exams for the residential program that's in Modesto. So far, so good. It's snack time. Hummus and carrots. I don't even wash my carrots because I figured the dirt has got to be good for you too. So I just got off the phone with the FAA because I got certified to do airman exams. And I'm doing my first one on Wednesday. And I didn't remember the login or the website I had to use. So they helped me through that. They're real nice. I wish the airline themselves were as easy to get a hold of as the FAA. That would make life better for everybody. And my awesome clinical director, Dr. Elizabeth Hilton, made me a little cappuccino or something. She just brought it to me. Nicest thing anyone's ever done, ever. Isn't that nice? So that was just a phone follow-up with a young lady who we've been managing her blood pressure with a lot of clonidine and propranolol. She's doing okay, not lightheaded or passing out. And we're taping her off Valium. She's going from 5 milligrams at night to 4 milligrams at night this month. She's cool. She's been in and out. I detoxed her off Suboxone like 7 years ago, actually. That was a shitstorm. But she recovered from it. She's off opiates. That's the good news. Catherine just pulled out the IV, and that tape hurt so bad. I don't think they make more painful tape than normally have. Oh my God. I just finished seeing about a 40-year-old contractor who came back from Thailand. No, Tahiti. He said it was a dump, except for his cabin over the water. He said Bali's better. He's on a pretty high dose of bupe we talked about, and I treated his toenail fungus. Good guy. So we just knocked off 2 Coast Valley patients real quick. It's a good program. They do the counseling, the programming, the IOP level care, drug testing, and then I just see them over the phone or video for medication management. So that works out pretty good. And they're really short conversations, so we can take care of a lot of patients in a day. I think it's working in the hospital for 25 years, but I live off cheese and crackers, or peanut butter and crackers. Pretty much. That was just another Coast Valley follow-up. This guy was on 16 milligrams a day, still having cravings. I would never, a few years ago, go above 16 milligrams a day, but with fentanyl, it seems like I have a lot more patients now on 24. I'm not convinced that it's the right thing, but it seems to prevent people from relapsing and craving. So I have more patients on 24 milligrams a day now than I ever did. I don't have anyone on higher than 24. I definitely don't think that's necessary. Except for when you're bringing people right off of fentanyl on that first day, we'll go above 24. So it's now 5:45 p.m. We just saw our second residential patient, this young lady with cannabis dependence, and I think borderline, who has self-cutting behavior, who is also in this program for a CPS case when she overdosed on Xanax and her 3-month-old baby was there. The last patient I just saw was an older patient with a long history of opiate dependence who moved into her uncle's house, and her 2-year-old daughter overdosed on fentanyl that was there when she moved in, that was left by her overdosed uncle or something. So she's now, they're both here in the program because it's court mandated by CPS. Neither one of them, interestingly, would have come in on their own. So we saw those 2 patients. She's my last patient for the day. It's 5:45 now. I'm going to finish these notes, send in something for her to sleep because she describes this insomnia. I just got home. I'm going to make dinner. And then that is the end of the day. So thanks for watching a day in the life of me. A day in the life of addiction medicine. And these dogs who are eating dinner. Good night.